What we have in the United States and in most of Europe, well, let's talk about the United States. We have the American Cleft Lip and Craniofacial Association, which is a listing of people that treat children with cleft lips and cleft palates. But more so, they advocate, just as you mentioned, a cleft lip or cleft palate team. Now, there's a lot of advantages to a cleft lip and a cleft palate team, because first, what is a team? A team is, as you mentioned, a group of not just surgeons. It's a group of dentists, speech pathologists, geneticists, pediatricians, ear, nose, and throat doctors. And the first approach is that rather than a parent with a baby take their baby to 10 different doctors, they can come to one setting and have that baby seen by all those doctors who can then communicate. The alternative would be that a parent would make 10 visits to 10 different medical specialists and then ask that each one of those call each other, which would be impractical. So most hospitals, like Maimonides Hospital, have a cleft lip and cleft palate team, and the doctors meet once a month. They see all their patients and discuss the treatment. Now, there's a second really good thing for a cleft team. If you think about it, a parent is now faced with a baby born with a cleft lip and a cleft palate. They are run to the internet, look up things, but it's a little confusing because it's a whole. I mean, the textbooks that I use have thousands of pages. So how is a parent, in the matter of an hour or two on the internet, going to really become an expert and try to guide the care of their baby? They'll know a lot and they can read a lot, but it's frightening for a parent because they're going to read. Not only are they going to read what they have to do, they're going to read a lot of opinions. And a cleft team reassures a parent that says, listen, we will guide you through the care of a baby. Now, we will guide you through the care of getting the baby treated at the lip closed, the palate closed, and then all subsequent care. For example, at 8 months of age, the baby needs their palate closed. At 2 years of age, the baby needs to see a special children's dentist who knows how to treat kids with cleft lip and cleft palate. At 4 years of age, they need to see an ear, nose, and throat doctor to evaluate their tonsils and their hearing, and they also need to see a speech pathologist at 2 years, 3 years, every year. At 5 or 6, they need to get potentially something done for their speech if there's a problem. At 7 or 8, they need to begin orthodontics. At 9 or 10, they may need a bone graft. And as you can see, at different stages, kids will need different procedures. At 11 or 12, they may need braces. At 14 or 15, they may need some secondary surgery. Well, for a parent to try to figure all this out from the internet is very hard, or just picking up a book. So a cleft team can reassure a parent that says, listen, we're going to follow your baby. We're going to see the baby at least once a year, sometimes twice a year, and we're going to make sure that that baby gets all the